Here it has shown how a titanium membrane can be used to graft an area that has experienced severe bone loss. Anterior tooth C here has undergone a severe bone loss, due to which the said anterior tooth will have to be extracted. While extracting additional bone loss has taken place. After an incision, soft tissue in anterior maxilla has been reflected back to expose the underlying bone. With help of drill holes are bored in the bone, and a titanium mesh is placed on the top and screwed to the bone. Bone regeneration material is placed inside the hollow space of the extracted tooth. A buildup of bone generation material in line with the bone structure is made. The mesh is wrapped around and placed over the build of bone regeneration material. A resorbable membrane is placed on top. The gum flaps sutured back in place. A provisional denture is provided to the patient to secure the site during the healing period. The resorbable membrane disperses once the area is completely healed, forming a complete block of bone. The flaps are once again exposed to retract the titanium mesh. The titanium mesh is unscrewed and removed with help of instruments. Additional bone regeneration material is placed in the screw holes. Now the bone is ready for the dental implant. The implant is loaded in the jaw. Healing screws are placed in the implants. The flaps are sutured back. A provisional denture is provided to the patient during the healing period. Once healed, the healing screw makes way for the final abutment. And finally the crown is cemented on the abutment.